Happy Wednesday, and welcome to today's webinar, hosted by Education Management Solutions and the Global Institute for Simulation Training. Today, our topic is Proving Our Worth Through Data, and we are very pleased to have Dr. Sharon Decker back with us today. My name is Lori Kearns. I'm one of your hosts today. Also assisting from EMS is Chris Qualtieri. Now, if this is your first time with us, welcome. And if you've been with us before, welcome back. Remember, you can close that control panel on the right side of your screen by clicking on the orange button. And the question panel is going to be very important today. We're going to use that for any questions that you have and also some dialogue that Dr. Decker will ask for a little while later. And also thank you for remaining in listen-only mode as we have a very large audience today. Now, if you're tweeting about your experience, please use one of these hashtags. And yes, we are recording the webinar. You will receive a link to the recording and the slides from our office within the next several days. We ask also that you provide feedback following today's webinar by completing a brief survey. Now, allow me to introduce Dr. Sharon Decker. Dr. Decker is the Associate Dean for Simulation, Professor in the School of Nursing, Executive Director of the Texas Tech University Health Science Center in Lubbock, Texas, of that simulation program. She is also a Texas Tech Grover E. Murray Professor and the Covenant Health System and Endowed Chair in Simulation. Dr. Decker's research and scholarship is related to how simulation can be used as an innovative teaching learning strategy to facilitate the development of critical thinking skills and promote clinical competency. She's been the recipient of numerous grants to support her research and has been recognized numerous times by the Texas Tech University Health Science Center for her excellence in teaching. She currently serves as the chair of the certification committee for the Society for Simulation in Healthcare. As a past member of the Standards Committee for the International Nursing Association for Clinical Simulation and Learning, Dr. Decker was the leading author for 2 evidence-based standards. Dr. Decker has been the recipient of the Texas Tech Chancellor's Council Distinguished Teaching Award and the President's Award for Academic Achievement, Excellence in Teaching, and Outstanding Professor of the College. Dr. Decker is a Fellow in the Academy of Nursing Education, American Academy of Nursing, and an inaugural member of the Society for Simulation in Healthcare Academy. Please welcome, with a very impressive background that it's hard to say quickly, please welcome Dr. Decker. And Dr. Decker, I am sending the controls over to you.
And thank you very much. And I'm laughing, okay? Welcome, everybody. Number one, those of you that know me know that I love to look at my audience. And so this is when I have to do a webinar, I have to pretend like you're out there. So we are going to try to do a little bit of talking during this presentation, and we'll see how it goes. So what we're going to look at is really proving our worth through data. And what we'll look at is to discuss some of the challenges that we are facing right now. And so I'll say we because most of us are facing it right now, looking at return of investment for simulation programs and for centers. We'll talk about the value of return on investment and hopefully present a method to you that can be utilized in the future to assist us as we try to meet this challenge. So, are you being requested? I am being requested. And the question that they throw at me right now is, now that you have the center, and now that we have the center in multiple sites, really show me the money. What is the proof that what we're doing is really working? How do we streamline the operations while we improve the service provided because of the impact that administration has on our budget? So I'm going to now have the first polled question presented to you, and let's see where we're at.
That poll is open, and those responses are coming in. And I can say, as you might expect, that the yes vote is quite high, but we'll give our audience members just another few moments to select. And I'm actually going to share that poll with our audience. Dr. Decker, a full 68% of our audience members are saying yes, they have been asked to prove the impact, and 32% are saying no.
Okay.
And we are back to your slides.
Thank you. So the 32%, you guys are so lucky. Okay. So what is return on investment? What they're asking us is to show a measurement, a performance measurement, to evaluate how efficient we are or productive we are related to the investment or related to partial components of the investment. So for us, when we look at that with simulation, what is the return on investment for our simulation center or program? Or it might be, what is the return on investment for a specific piece of that program or one activity of that program? So again, one more polling question for you.
All right, and that poll is open. And the question is, are you being asked to validate the return on investment? And those responses are coming in. These are a little different, Dr. Decker. I'm seeing no is in the lead. I'll give just another few seconds. Okay, so of our audience responding, 57% are saying no, and 43% are saying yes.
Okay, great.
We are back to your slides.
Thank you. So I kind of expected that, because what I'm seeing right now in the literature and when it comes to simulation programs, the ask for return on investment is just now starting to appear in the literature. So if we look at return on investment and we say, what does it mean? You're looking at the productivity of the investment, like we talked about a minute ago. And there is a formula that can be utilized if we're looking in accounting methods. And that is looking at the income minus the expenses, okay? So you're looking at what was gained from the investment minus the cost of the investment times 100 over the cost of investment, and that gives you the percent of the return on investment that you get. So hypothetically, we could say a simulator costs $50,000 to purchase. That's our investment. It generates $100,000 a year. I wish, but let's just say that. The return on investment at that point would be 100% mathematically. So let's move. And all of you are now sitting there going, yeah, Sharon, yes, we know that, right? We live in a very complex world. So you look at our simulation programs and our centers, they're complex, they're integrated. The entities are hard sometimes to explain how everything fits together. And if we just look at it with mathematical formulas, sometimes we cannot show our value. So what we need to discover is, how can we describe, how can we document the different forms of value that we have? And as I was looking at the literature, and there's very little out right now when it comes to looking at return of investment for simulation. But one talked about the fact that you and I need to be looking at the holistic value or the gain. And so think about that as we talk about it. And so what I would like to pose is, and this one I want you to kind of add in that chat box, is what is the value specific to simulation-based activities? If I said to you, what is the gain? What is the holistic? What do we do? Give me some words.
And use your question pane right there and click send. And I will identify, oh, they're coming in, Dr. Decker. I'm seeing safe patient care, student confidence, quality improvement, experience for professionals, student outcomes. Oh boy, they're coming in quickly. Evaluation of student and program outcomes, safe learning environment. I've seen that a few times. Lives saved, clinical skills, reduce patient harm. Really good responses, Dr. Decker.
Okay, excellent, y'all. So what we're going to be looking at is a method that we can utilize to show our value, not just in numbers, but also use a value matrix, which allows us to address some of those issues that you presented. So this one's called a value measurement methodology. And looking in the literature, it came out in 2002. There has not been a lot of movement with this methodology, but one of the recent articles that came out related to looking at simulation and return on investment, which you'll see in the reference, talked about the value measurement methodology. So what you do with it is you accept the fact that, one, our value is complex. Our values are interdependent, but measured in tandem. Okay, interdependent, measured in tandem. And what we'll be looking at is, one, yes, financial. There is a cost. We've got to address it. We can't get around it. It has to be out there. We're going to be looking at some of the things that we can measure quantitatively, and then some things that we might have to measure in a qualitative manner. So there's some quantitative benefits, qualitative benefits when we look at simulation. So with the value measured methodology, it allows you and I to leverage ourselves, to leverage our program. And it allows us to demonstrate our value looking at education. What do we provide? So it may be in that academic sense, looking at our value when it comes to clinical, that could be academic and or patient care. Operational is embedded into the cost and into our financial data. So we're going to be able to look at everything. Is it going to be easy? The answer is no. It is a very complex system, but the more I look at it, I'm realizing that it is the system that I'm going to have to use to really answer that question that has come out. What is your return on investment? Now, interesting, I was working on another project today and I was reading an article, and so I'm going to read you a couple sentences, quote from this article. The most talked about disadvantage of simulation is its questionable return on investment. It's questionable return on investment. Institutions spend significant resources to change their curricula without knowing what the actual benefits of the technology are. So the literature right now is starting to really look at simulation. You know, we've proved certain things. This is the next, I think the next thing that is going to bubble to the top for us to make our jobs just a little more complex. So cost, we've got to think about cost. And when we look at it, you know, think about just deploying a simulation-based activity, not building a sim center right now, but just one activity. We've got to have data related to acquisition, i.e., those simulators that I use on that activity, how much do they cost? What is their life cycle? Do I have in software insurance licenses that I have to spend? I have to look at my maintenance and op for the activity. What are the supplies we use? What is the equipment we use? Oh, how much time does it take for you and me and or the faculty in developing the activity and setting up the activity? Oh, by the way, if faculty are going to help with this, how much time has it taken for us to provide the faculty with the education that they need so that they can assist in the simulation? And you mean we have to have staff to support SIM, which also includes standardized patients? So that the cost is very complex and very scary. Then quantitative. Again, we're looking at gains or savings. So piece with here, the one thing that's very important for us is sometimes I don't have this myself. And it is legitimate for us to go into the literature and look at some documentation related to, let's go with central line insertion. Once they've done deliberate practice, there is validated time savings related to the procedure itself. There is validation related to a reduction in errors. There is validation related to the fact that once a person develops their competency in this skill, that they then have a better completion time and less complications. And then we can look into some cost reduction related to training. So when I'm starting to look at this component, again, I do not have to have it from my center. I can go into the literature to pull it and document and prove my worth. Qualitative, again, these are my gains. A lot of these we can't flip over into a financial formula. So if you look at it, how do you value patient safety? You mentioned that. How do we value patients' lives? But again, I can go into the literature, and this is not Sharon Decker saying simulation training helps prevent errors. Simulation training correlates with patient quality care. I can, again, go into the literature and pull that across and document where it came from. We can look at the learnings and the skills that are obtained through simulation. We can pull data related to learner and faculty satisfaction related to teaching with and learning with simulation. Then I can pull data related to, how about my organization itself? Is my organization, the reputation supported by the Simulation Center? Think about the tours that you give. Think about the speeches that you give. The activities that are involved, which they don't see you as an individual, they are seeing your institution. These things you and I can help pull from by doing some very good questionnaires and surveys and getting data that we can then utilize, like learner and faculty satisfaction. We can get that data ourselves and slide that into our document when we start to prove our worth. So we'll backtrack a little bit and talk about each one just a little bit more. So value. There's going to be several components of this model, and one is the value. If I can prove value for the learners, the faculty, the organization, and society itself. So value to the learners. I can get into the literature. Some of this is there for us, and you mentioned some of this when I asked you that question. Improved clinical reasoning. We have the documentation, we have the research that does demonstrate the fact that simulation improves clinical reasoning when it's done appropriately. We know it increases the students' competence and their confidence, two separate things. We know that there's an increase in learning. We know we can get satisfaction from it. And the other piece that sometimes we don't think about highlighting when we do these types of justification is that there are experiences that our students cannot get in the clinical setting if we do not give them in a simulated environment. So we need to highlight those as value to the learner. Then you have value to the faculty and or educators. Again, sometimes we don't pat ourselves on the back. Teaching our faculty and educators, we're providing them a new knowledge, a new skill set that we need to demonstrate and show, hey, we've done this in service. These are the vals from it. This is what faculty say about our service that we provide. Then look at not only your scholarly activity, but look at the scholarly activity that faculty can engage in because of the Simulation Center. How many of them present at conferences? How many of them are engaged in articles that are published or in research? Those, again, are proof that we need to share and use as we work through this one. And what is their satisfaction? Value to the organization. If I'm in acute care setting, we know that simulation can decrease length of stay. And there is numbers that we can pull from that say if somebody can decrease their length of stay X number of days because the individuals were taught utilizing SIM and therefore they did this, and this, they would have a decrease in length of stay estimated 3 days, which can equal to X number of dollars for the institution. We know that teaching with simulation helps prevent complications. So again, we can play on that. For those of us in the academic setting, things that we should highlight is, what about the grade appeals? I know for us alone, we have had less grade appeals once we incorporated simulation and once we started the videoing of every testing sim or any OSCE. And yes, we follow our protocols and all that good stuff, but still they're available. So if students appeal to a faculty, why did you give me this grade? And the faculty then can sit down with the student, pull up the scenario, watch it. About 99.9% of the time, the student goes, oh my gosh, I didn't realize I did that. And it completely changes the way they're looking at the grading criteria. Public relations, the tools, the tours that we give, recruitment of not only students, but also faculty. I know that in our Sim Center in Lubbock on Friday, every medical student that is looking at TTU HSE Lubbock campus goes through our Sim Center. And now the medical students are running those tours because they want to showcase what they have. They're proud of what they have. Helps our reputation. Then you think about all the media events that you can assist with. And again, that goes right back to value for the organization. Then I heard you say this, our value to society. We are improving the quality of care. We are enhancing patient safety. So again, those are words that we need to utilize when we provide them this document. So our value also to the organization. It has to be strategic. I should also demonstrate when I'm working on my return of investment document is I demonstrate to them immediately that our strategic plan, our strategic goals are correlated right back to the Health Sciences Center's strategic plan. And this is how we're going to help them accomplish their strategic goals and then show them, okay, administration, how we propose to measure it. And so this, again, out front so that they see it over and over and over again, because they're looking at what value do we have back to the organization. So value. Then we look at cost. And again, most of the time we think about cost, that's what most people think about with ROI is the cost. And maybe cost of the activity and or cost of several activities, or it may be when I'm initially doing a proposal, cost for a whole SimCenter. Well, not only initially, but could be the cost of a whole SimCenter. So when I look at cost, this one to me is the hardest one for us to work on, because if I'm doing an activity, we already mentioned this, but again, think about all the pieces that you have to put into that cost. So your development time, acquisition time, your maintenance and op, your support, and faculty development. And then for those of you that are in the acute care setting, you've got to think about if we're utilizing this for orientation or staff development, they will expect you to put in staff time, their time away from the bedside. And we've got to show how we can decrease the amount of staff time away from the bedside by utilizing simulation in lieu of other ways of providing the same materials to our faculty and to our staff. So I believe
we have another poll.
Yes. Oh, yep, we have another poll.
And I have launched that poll. And the question is, have you implemented a system for determining inventory cost control of disposable supplies? And those results are coming in. And I don't know what you are expecting or what you would anticipate, Dr. Decker, but I can tell you that in the lead right now is the response no. So let me close and share that information. So 70% of our audience are saying nope, they've not implemented a system, and 30% are saying yes.
And very interesting.
Yeah, we're back to your slides now.
Okay. To me, this is interesting. So I would say this is another piece that we in the simulation community are going to have to be looking at, because once we are required to show a return on our investment, again, we've got to have that cost that we can say, this experience costs X amount, and we know it costs X amount because these are the supplies that we use, and we can give them a cost to the supplies. I feel as a nurse, I feel like I'm beginning to walk into the business world. I feel like my sim centers are mine. I take personal pride of that. But they're becoming small businesses, and I've got to make sure we have the capability of proving our worth with those small businesses, that they're not costing extra money to the organization. The next piece is that risk. And so when you look at risk, you're looking at one, when you initially do a proposal, we look at what is the risk if it wasn't done, okay? We have to use that same proposal or same thought process when we start working on this document. So if we did not have this center, if we did not provide training related to this, or we did not require competency base or mastery of learning, this is a potential risk to our learner, to the faculty, to the organization, and then to society itself. So, we have to state what we think the risk is, how we're preventing that. Now, with the initial center, what you've got to be able to do is not only do that risk, but you're going to do it in more of a SWOT analysis component. So you'll look at your SWOT. The other piece is if you're looking at a proposal for either the initial, or now they say to you, what about sustainability? You've got to go back to your risk. You've got to go back. If it's initial, you've got to say, is my organization ready for this? Do they have method in which I can sustain the simulation center? Or am I proposing something that says, hey, I want this, but after 2 years, there's no money coming in? So you've got to look at that and approach it and talk about it up front. So another question, and this one will be one that I've got embedded, so I want you to add into the chart. So this is, what data should we be gathering right now to think about our return of investment? What data should I be gathering right now?
And use your question panel to present your ideas to Dr. Decker. Oops. And I am seeing attitude surveys, student feedback, participation, grades of learners past and present, confidence level of clinicians, faculty feedback, staff costs, use times, that comes from Gail, patient safety, facility input, cost is coming up quite a bit, faculty feedback, that comes from Mary, number of learners, number of events, that comes from Margaret, and participation from Elizabeth.
Okay. So let's see what my generation was. So let's go into this. These were, again, I just did some brainstorming. So, and add to what you've got right there already. Patient care setting. Do we have studies that we can utilize? And what I would say to you and I, and we'll talk about next pretty soon, is what I'm going to recommend to myself after I've done a lot of studying now is I'm going to put together some files. So if I have an article I come across that talks about decreased complications related to simulation, that article is going to go in that file. If we have patient satisfaction surveys that we're doing, those are going to help me before, after. Maybe I can see staff satisfaction. If you're running a residency program or an orientation program, look at your retention rates of the staff before you integrated SIM and after you integrated SIM. So when you look at retention, those figures can be from, I can see from 40,000 to 80,000 per nurse, registered nurse, if they lose them and have to reorient somebody else. So then again, can we help with maintenance of cost through excellent education? For other things, utilization statistics. I need to look at the ones that I'm running, and I know you all mentioned a lot of them there. Put them in Excel format and think about all the different ways that you can use those statistics to demonstrate your worth. I.e., if I have a presentation to the School of Nursing, I will pull their statistics and get it ready. If it's for medicine, I'll pull their statistics. Health professions, theirs. Tours. If I'm talking to the president, he's going to get every statistic I have, but done very, that he can see it very, very fast. Think about your utilization of your simulators, your equipment. How often are they utilized? Again, we talked about tours. I can't say enough. My staff gets so frustrated with the tours. I would say we have at least 4 a week, and those last from 1 hour, and sometimes we have those extended tours where they really expect us to almost engage with the students for 3 hours. And that takes time away from work, but the PR that we do, the feedback we get from those tours is phenomenal. Looking at student retention rates. Are we retaining our students at a higher level because once they've integrated SIM into a curriculum? Reputation of the program. every article that is written, have record of that, if it's related to SIM. If they've done a highlight of your SimCenter and they have it in their university magazine or the newspaper, cut it out, keep it. Look at your faculty that are engaged in SIM, your staff that are engaged in SIM. Highlight them. If they get certified, make sure everybody knows it. And then their activities when it comes to national organizations, which sounds, sometimes we look at them and we think, oh, is that important? Yes, it is. Because one more time, organizations like their name out there. In this article, they had, and this was the article that I talked about, and again, it's also going to also be in your web. They had several diagrams to assist you in looking at the value measuring methodology and things to look at when you work through the process. And if you notice on here, you know, they talk about value, direct value, social value, operational value, strategic value, financial value. So you can break it down to multiple levels as you work on your documents for your administration. They also had this diagram, which was, I felt, exceptional. The reason I will say that is, again, when you look at total costs, sometimes when we start looking at them, we don't think about all the pieces that are involved in the cost, i.e., thinking about life cycle considerations. Not everything lasts forever. And that has to be, we have to look at what is the recommended life cycle for the different components that we have. Simulators are one thing, computers are another thing. They're different, but those, I've got to utilize what the manufacturers recommend and do my breakdown of my equipment, my simulators, so that I can see life cycle and integrate it into my cost analysis. Again, is this easy? No. We've already talked a little bit about your supplies. And then so you can look at this diagram and you can see that there's certain things that they feel that the authors felt we could come up with numbers, but there are things that we cannot come up with numbers. Those are our intangible values, and that we need to, as a simulation community, be highlighting those values in this return on investment document. So you cannot place money value on everything. So when I look at my report, I've got to think about the whole gamut, my value, my holistic value that I have. And what I say is, if statistics, data, to me equals money. If I don't have the data that I can prove our worth, I cannot go forward to request more money. So that it's a constant gathering of that different data, so that when I need something different or we need to grow, we can come up with a proposal that is based on those statistics. So looking at it, I mentioned a little while ago that I recommend, and I'm recommending this also to myself, is that we need to be acquiring this data. And yes, I've got utilization statistics, I've got all that. What I don't have right now is my files for discussing the cost benefits, the files that I need for that prove our worth. Okay, those files I'm going to start compiling for myself, so that when I have to write this really recommended, ask for proof, I've got it. And it's going to take me a while to pull it together. Look at your requirements that you need for accreditation and utilize them as you do the return on investment. If I get accredited, what will it do for my center? Okay. We talked about utilization statistics already. We talked about the tours. We talked about the scholarly activity. And we've talked about media support. Anything I can do to highlight our center. So from there, I am going to open up for questions and thoughts.
Okay, thank you very much, Dr. Decker. Now, we have had a couple questions about references, so you might just go ahead and advance to your next slide. Yeah. Now, if you can't read this, I don't have time to take it down, not in a place to do that, don't worry, because you're going to get this slide deck. But we did have some questions about references, and really specific to qualitative benefits and decreased stay. Now, does anything in your bibliography here address those two, or do you have any other ideas for those two areas?
Okay, those are really going to come from, let's see. The first one up there from Brown has a little bit on there. The Council for Best Practice also has a little bit, but not a lot. Those are things that you've got to, I mean, literally when you stumble on them, grab them, because it's usually you're stumbling on them when you're looking for something else.
Right. Okay, good. Thank you for pointing those out. That's very helpful. We've also had a question. Sarah is asking about any spreadsheets that you might share. Did you create those spreadsheets? Did you gather them from any place?
Created them. So it's just wonderful Excel documents. And then what I've broken down is into how I would like things, like our utilization statistics. I literally have to have what is the course, what is the number of students, what are they doing. So anything you can, as you break it down, that you can go back later on to pull it up and to be able to say, we have done X number of high fidelity simulations related to blah, blah, blah. Okay, we've used standardized patients in these number activities. And the student's evaluation related to it is this.
Okay, thank you. You also mentioned an article today that you read a couple sentences from. Mary's asking if that was about the questionable for ROI, which left me a little speechless. But she's wondering if that's listed in the bib or if that's another reference that we might be able to provide.
Okay, that's another reference for us to provide. And you know what I'll do when I redo this, I'll send it on to it, because it was something I was working on pharmacy this morning, because we're going to have to do some retail pharmacy experiences and trying to figure out how do you go about designing them and trying to explore. So this is for anybody and everybody out there. Explore, is there a portable retail pharmacy that anybody has developed that can be moved, and you can set up a retail farm in a minute. But anyway, so I was exploring that this morning. And so I was looking into pharmacy, and this happened to come out of the American Journal of, well, it's one of their pharmacy magazines, but it was written in 2011.
Oh, wow.
2011, and it's now 2017. And it's real interesting that at that time they said this was one of the biggest challenges, and I think it's just now really becoming the big challenge.
Okay, so you mentioned that you'll add that to the reference list.
I'll add that to it.
Okay. So we will distribute the final copy of the slide deck when we distribute that, and the link to the recording in just a couple of days, and so you'll have the most up to date. So Elaine's asking a question. She says, how do risk management departments justify their costs, and can simulation centers use similar methods? That's a great question.
That is good. If you look at one of the references, which is the ROI, the first one, Brown, that how to drive ROI for your healthcare improvement projects, those are, you're going to see that what we're looking at is really what some of those areas have had to go to also, because some of them do not have the numbers that accountants look for. And so when you look at it, you're going to see that only one of those articles that are out there, even, well, there's two of them that talk about simulation, but there's really only one that really focuses on ROI of simulation. So yes, I agree. We're going to have to go to others to pull what they're doing.
Mm-hmm. All right. Cameron's asking about, do you see many sim centers leasing simulators? Is there a benefit for spreading out the cost and refreshing equipment? That's a tough question.
That's a tough question. I don't know if, because do they lease them? It's more of lease space within their sim center. So having people come to them. I don't know of none in our area that lease simulators where people can rent them. That would be something that would be interesting to cruise and look at.
Mm-hmm. Mm-hmm. Andy's asking about surveys. She's saying, have you ever asked survey questions for students before, after, and periodically, like 3 months after simulation, that could prove their worth?
And the answer is yes.
Okay. So you utilize that information as a part of your maybe qualitative...
the quality improvement of the whole program for the simulation center. Now, do we get the results? I mean, do we get the amount of results that we want? No. What we're doing this year, we've just initiated, is that the directors of our centers are going to now start periodically going into, and we won't tell the faculty until it's the day of the experience, just before their experience, but as soon as their experience is over, we're now going to go in and be pulling the students, because we're not getting what we want by just please fill this out.
Okay, sure. We have had a couple of people respond and say that yes, they have been able to lease simulators. So it may be a geographical thing or a simulator company thing, but there are some who's saying that yes, they can do that. And also Jeff's mentioning that some sim centers in the Los Angeles area lease their space to companies that film commercials and such in their lab. So that sounds like a geographical thing as well, because that's where that industry is located. Now, we've had a question that I've hesitated to ask because I know this is a really tough one, but I'm just going to put it out there because it may be on several people's minds. But we've been asked about initial investment for SimLab. Now, that can be all over the map. But
all over the map.
Yeah, but if you want to speak to that.
So what are they looking at, the cost for the initial investment, or?
Yeah, for like the smallest center. Let's say the smallest center. Let's just hit that one. And I know that's a tough one.
That's a tough one, because it would be, if the smallest center, I would say smallest one room. Okay, so I'm looking at somebody probably from acute care industry. You would need probably one adult, one baby, one female mannequin. About $250 when it comes to partial trainers. That is, let's go 70 times 270. I'm going to go 400, 0. This is not the build out. I'll give you a build out in a minute. 712. 1, 5, 6, 7, 8, 9. I just added up $1 million just for the simulators and the equipment alone.
That was impressive that you could even do that. So I'm impressed by that.
Okay.
And I thank you for giving that one a shot, because that's a hard question to answer.
That is hard.
Yeah. Yep. Kristen's saying, I totally agree about $1 million. So
Good.
it seems like
I'm not off the deal. Okay. There's two of us, therefore we're correct.
yeah. So here's another kind of challenging one from Mary. It says, any advice for someone who has demonstrated measurable outcomes, return on investment, but still does not get administrative buy-in?
Oh gosh.
Yeah.
That's a hard one. And this is what I'd say, and it's really been fun to watch. Don't get discouraged, number one. Number two is just sit back and wait, because some of those administrators now are starting to go to conferences where simulation is starting to appear, or their peers are starting to talk about the importance of simulation, or look what we have. And it seems like it takes it coming from that realm instead of you and me singing the song. And as soon as that happens, you want to go, yeah, I've been telling you that.
There you go. Okay, so yeah, it's hard to be a prophet in your own land, maybe.
Yes.
Yes. To have them see the benefits from other people in the field.
And their peers. That's the catch. It's their peers.
Yeah.
Okay.
Yeah. Okay. All right. Great ideas. Okay, so there are a number of questions coming in, and I really respect and appreciate you taking the time to answer these, Dr. Decker, because this is a wonderful audience, and you are just a fantastic resource for folks. So I want to try to get to as many as I can, even if they feel a little bit out of order.
Oh, that's fine.
Casey's asking about the evaluations and what kind of questions do you ask on the evaluations? And maybe I'll just add to that, who all do you survey? That's another question that I would ask.
Okay. So if you're looking at, for us to get, because, well, I'll tell you how this all came about, is we're getting ready to go up for our accreditation. And going through that process has been phenomenal, heartbreaking, tough, but it's the best self-critique we could have gone through. And so what it's made us look at, what is the data that we need, that we want from any of our customers. And I'm talking any from students, people that come through the door for tours, people or the faculty that utilize us. And so the questions, not only satisfaction, but looking at how did we set up the rooms? Was the room set up so that they were realistic? Did we have the appropriate equipment available for them? Going right down into the components that are appropriate for a simulated experience, and asking, do we have that? Are we doing this right? I don't know. I'm hoping that answered the question.
Okay, thank you. We've had a couple of people, Sarah for one, we've got several friends out there, so thank you to Sarah and Mark and many others that are friends of ours. Oh, wait, let me just ask this one question, a clarifying question from Mark. He's saying accredited through who? Would that be SSIH?
Yes,
okay.
SSIH.
Okay, great, thank you. Sarah's saying, Sharon, this is amazing work, and thank you for sharing. Would like to consider a group to address this growing need and ways to provide materials, resources, and support to those needing to implement these ideas. So one thing that I will mention that is when we post this webinar recording, we do it on our YouTube page, and there is places on there, as you well know, to add your comments. So I would recommend, this just coming from me, and Sharon, you may have other ideas, but I would recommend that we use that as sort of a forum to continue to dialogue a little bit about this, or to network. What are your thoughts about that?
I think, who'd you say wrote that one? Sarah?
Sarah.
Okay. I think she's right on the mark, because, I'm looking at where we are and think about where we've come. And when we initially started in the simulation pathway, we had questions to us like, prove it that it works, prove it. And we have data that proves SIM. And I feel like, yes, we're going to keep gathering that data. We're doing great. I think this is the next step that is now going to come to us that will say, okay, now it works, but prove that there is a return on the investment. And so what I would say is, yes, very definitely, we should not, as an individual, I can't do it alone. And this is something I think that is going to take a group to get together and say, hey, let's come up with a template to assist simulation centers, programs in developing their return on investment strategy documents. It's this, same thing as when we started and we had to say, okay, I've got to write my strategic plan. I know what the initial strategic plan I did for SIM, there was nothing out there. And so we stumble along, we get better, but we shouldn't stumble along by ourselves. We need to be sharing what we discover with each other and helping each other.
Mm-hmm. Yeah, that's a great thought and well stated. Cameron also has a really good question. And she's saying, do you use your debrief system to retrieve usage analytics?
Some of them do, yes. Okay, so it kind of depends on who the course is and what's going on with it. So every course may be a little bit different, or every program may be a little bit different.
Mm-hmm. Okay. Candy's saying, we recently demonstrated our worth by showing our new CEO, which right there is an opportunity, a video of our labor and delivery sim for shoulder dystocia. And he was very impressed in how we use video to debrief and the learning that takes place during the debrief.
Beautiful.
Yeah.
And then you can go to the literature and say, and you know how much, no, think about, because there is proof that if you can prevent one episode of shoulder dystocia, there is a value to that. Mm-hmm. They've got a money figure to that.
Mm-hmm. Well, and to that point, Kristen had asked a little earlier, what about calculating risks? Is there a way to talk about risks or potential risks as an ROI for simulation?
Yeah. But we've got to do it very strategically. It's going to be the catch.
Yeah. Any thoughts on that? Is that, again, something that you're thinking about would be good to have a meeting of minds come together? Or do you have some thoughts about a direction to move in?
I think that's a meeting of the minds.
Okay. All right. Fair enough. Okay. So right now we've got a lot of people saying thank you. This is very informative. So that lets me know that it's really towards the top of the hour. Mark, Sarah, Candy, Mary are all saying thank you, loved it. So any last final thoughts from you, Dr. Decker?
No, I think the final thoughts are we got a lot of work to do.
Yeah, and here we thought getting sim centers up and going was the work, but now we're finding that the real work is just what you talked about today, which is demonstrating to our key stakeholders and others the real return on all that good work that we've been doing over the last many years.
Right.
Okay. Well, the thanks continue to come in. Betsy, Kathleen, Margaret, Nita, Lori, a different Lori, Edward, Mary, Rebecca, and on, saying, great talk, lots of good ideas. Thank you. Excellent presentation. Best webinar I've had the pleasure of viewing in a while. Thank you so much. So that says a lot right there. So with that said, Dr. Decker, I'm going to say to you and our audience members, thank you so much for your time. This was very enjoyable. Loved all the interactive components, and just really want to thank you for your time and wish you all the best moving forward, and have a great rest of the day.
Thank you very much. Bye-bye, y'all.
Bye-bye.